Welcome back. A number of great health topics to get to in just a moment. Starting with this one, ADHD often misdiagnosed, but a new study is bringing more attention to the disorder and its effects on women. When left unmanaged, attention deficit hyperactivity disorder can affect a person's ability to manage other chronic health conditions such as diabetes and depression. And women with the disorder often face a different set of challenges than their male counterparts. Dr. Corey Hebert, WWL Louisiana Chief Medical Correspondent, is here to clear up the misconception. So we're seeing a number of women diagnosed, but we were talking about it. It's not necessarily something new. It's just that they weren't being diagnosed in the past.
Right. And this is something that is really, really near and dear to me, as what we have found is that women are masking. Now, what does that mean? That means that women are actually having ADHD for many, many years and then just finding out because of more clarity about this disorder. So a woman, I'm going to give you this, is a very disturbing statistic. If you're a little boy and all those criteria that were invented for ADHD diagnosis were about little boys. Let's be very, very clear. So if you are a little boy and you have an IQ of 100, you'll usually get diagnosed at around 6 years of age because you're bouncing off the walls, right? If you're that same little boy and you have an IQ of 120, meaning that you have a higher IQ, then you're usually diagnosed at around 8 years of age. But if you are a girl, because you're not bouncing off the walls and you have an IQ of 100, then you usually get diagnosed at around 10 or 11. But if you are a girl, a woman, and you have an IQ of 120, you don't get diagnosed with this until you're 28 years old.
Wow, that's a long
now,
time.
what does that look like? That means that usually it's hard to find a job. It's hard to keep a career path together. You're having difficulty in romantic relationships, difficulty in friendship relationships. You are generally have at least one space in your house that is very, very messy, although everything else is very organized. You have an increased risk of addictive behavior, sexually transmitted diseases, and pregnancy at a young age. But all this means that you still have a generally great job and you are falling apart because you're overwhelmed trying to keep everything else together in your family. This is usually something that is hereditary, so your mother or father may have had it, and then you give it to your daughter, and then the whole house can be a disaster. So what we're looking at now is that you must address this. This is not normal, and it's nothing to be ashamed of, but we found that if you get diagnosed and you get treated, this is really taken care of for you by the treatment about 80% of the time. So this is almost an emergency. The increase of women being diagnosed with ADHD in the last 2 years has doubled, not girls. Women has doubled. So what we have to do is tell young women, and not just young women, older women as well, you don't have to suffer. And this is very important to me because I find young women all over the city, all over the country are coming out now saying, I just didn't know that I was having to struggle so much, and it's just not fair.
Wow, yeah, and you're mentioning women, so they've already lived a good portion of their life living in this chaos and thinking it's them.
Thinking that it's them.
Wow, this is a great study. Okay, we are tighter on time.
Yeah, so we can talk about the melatonin.
Let's talk about the melatonin, because this one immediately as a mom, I was like, wait a second, but there's melatonin for kids. And so basically what this is saying is that melatonin, that parents are leaving their melatonin out.
Correct. And basically what's happening is that you're having a 4-fold increase in overdose of melatonin in the ERs. Now that's because melatonin is a lot more available, but children are overdosing on melatonin because it's usually in a gummy form. Same thing with gummies, marijuana gummies, okay? So the key is keep all that away, but melatonin is not unsafe for children. It actually is safe. You just have to use it for the children's dose and keep your adult melatonin away from it.
Yeah, especially with all these like sleepy girl drinks people are doing and all this other stuff.
That
just
is
don't
correct.
leave
And we
it
get
out.
melatonin for ADHD sometimes, and that's why these stories are actually very kind of for them to sleep.
Uptick in ERs is because they're overdosing on the adult one. So
that is correct.
Just keep that stuff out. All right. Thanks so much for joining us. Always insightful. Our website, WWLTV.com, is where you can find all of the topics we just discussed with Dr. Hebert, and many that we've looked over throughout time as well. And we've got plenty more to discuss next week, so stay tuned.